Hi, this is Jamie, and this week we're talking about antibiotic stewardship, which basically means as healthcare providers, we give the right antibiotic at the right time for the right infection and for the right duration. And again, as nurses and doctors and other healthcare professionals, our job is to be an advocate for the patient. And nurses are often the ones who actually administer the drug, so we should be the ones to question if we think that it's not the correct drug that the doctor is prescribing for the right infection. Um, we're often the last lines of defense. That's why we have to be the patient advocates and make sure that the patients get good quality care and the right care. In my clinical setting as an OR nurse, particularly a cardiac surgery nurse, um, surgical site infection is a huge, huge deal. That's actually brought on national initiatives to decrease the amount of surgical site infections that there are. It's called SCIP, which is the Surgical Care Improvement Project, which includes an entire antibiotic protocol. um, Sternal wound infections in cardiac patients are devastating and often deadly for these patients who their ICU stays are extended greatly. They've got to go back to the OR a couple times. Um, it, it, the result is just a lengthy stay, a very bad stay, a very sick patient. So I can see why surgical site infections have caused huge initiatives from a national standpoint. But anyways, the protocols regarding the antibiotics, particularly in my field, include antibiotic administration beginning within at least 1 hour before cut time or incision time. And if and usually what we use is ANSEF where I am, which is a really good, it's a cell wall inhibitor, and it works really good against the staph infections. And if they're allergic to the beta-lactam, like ANSEF, then we give it vancomycin 2 hours prior to incision, and that's included in the protocols. And we make sure that that's done. We communicate with each other. Anesthesia communicates with us, which communicates with the surgeon. And then also post-procedure, so then during the procedure when they get ANSEF or vancomycin, they have therapeutic levels of this drug throughout the procedure. And then post-procedure, the idea is to discontinue the antibiotic within 24 hours, actually 48 hours for cardiac surgery patients, but 24 hours for regular vascular surgery patients, um, in order to reduce the risk of bacterial resistance. So that's just some of the way that my clinical practice area advocates for antibiotic stewardship. All right, thank you.